Hello, Study Nurse IQ audience. Welcome back. I'm Jenny. Today, we are zooming in on the workhorses of psychiatric pharmacology, the medications we use to treat anxiety and depression. Specifically, we're doing a deep dive into the two most common and critical classes: SSRIs, selective serotonin reuptake inhibitors, and SNRIs, serotonin norepinephrine reuptake inhibitors. Understanding these medications, their mechanisms, their side effects, and especially their dangerous interactions is non-negotiable for passing the NCLEX and practicing safely. Stick with me until the end because I have 3 tough NCLEX questions waiting to test your mastery. Let's get started. 1. Selective serotonin reuptake inhibitors, SSRIs. SSRIs are the go-to first-line treatment for the vast majority of depressive and anxiety disorders. They're popular because they are generally safer and have fewer side effects than older drug classes like the TCAs. Mechanism of action, the serotonin booster. The name is a perfect guide here. SSRIs are selective because they primarily target one key neurotransmitter, serotonin, often called the feel-good or calmness chemical. In the brain, a nerve cell releases serotonin, and then the sending cell quickly reabsorbs it, a process called reuptake. SSRIs work by blocking this reuptake mechanism. Think of it like this. The SSRI plugs the drain, forcing the released serotonin to stay active in the synapse, the gap between nerve cells, longer. This increases the amount of serotonin available to bind with receptors, which improves mood and reduces anxiety. Key medications. Look for names ending in -tine or -line. Paroxetine, sertraline loft, fluoxetine. Primary uses depression, generalized anxiety disorder, panic disorder, OCD, and PTSD. Critical nursing teaching points. Time delay is crucial. SSRIs are not fast-acting. It takes 4 to 6 weeks to feel full therapeutic effects. This delay is the main reason clients stop taking them too soon. Encourage adherence. Common side effects: sexual dysfunction, decreased libido, weight gain, and sleep disturbances, either insomnia or fatigue. Educate clients that these are common and manageable. Black box warning. For children, adolescents, and young adults up to age 24, SSRIs may increase energy and motivation before mood improves, raising the risk of suicide. Close monitoring is essential. 2. Serotonin norepinephrine reuptake inhibitors, SNRIs. SNRIs are the powerful dual-action class. They are often used when SSRIs are not effective or when a client's depression is accompanied by low energy or pain. Mechanism of action, the dual powerhouse. SNRIs are similar to SSRIs, but they have an extra target. They inhibit the reuptake of both, serotonin for mood and calm, norepinephrine for energy, alertness, and focus. By boosting both, the client may experience an antidepressant effect, plus an increase in energy. Key medications. 1. Duloxetine Cymbalta. 2. Venlafaxine Effexor. Key unique uses. In addition to depression and anxiety, the SNRI class, especially duloxetine, is highly effective for treating neuropathic pain and fibromyalgia. This is a great NCLEX distinguishing feature. Specific caution for serotonin norepinephrine reuptake inhibitor SNRI is hypertension. Because norepinephrine is a vasoconstrictor, clients starting an SNRI are at risk for elevated blood pressure. Nurses must monitor blood pressure carefully, especially when starting or adjusting doses. The life-threatening danger, serotonin syndrome. This is the most critical interaction to know for both SSRIs and SNRIs. Serotonin syndrome is a life-threatening condition caused by overstimulation of serotonin receptors. The key interaction. The biggest trigger is taking an SSRI or SNRI with another substance that increases serotonin. The most common offender is the herbal supplement St. John's wort. Never take St. John's wort with an SSRI or SNRI. Other high-risk combinations include MAOIs, TCAs, and triptans used for migraines. Recognizing serotonin symptoms, the triad. This includes mental status changes, agitation, confusion, anxiety. Autonomic instability, high fever, tachycardia, profuse sweating. Neuromuscular changes, muscle rigidity, especially in lower limbs, and hyperreflexia. If a client presents with this triad, hold the medication and notify the provider immediately. Let's quickly test your grasp on these essential concepts. Question 1. The nurse is providing discharge teaching for a client prescribed paroxetine, an SSRI. Which statement by the client indicates understanding of a common side effect? A. I will need to limit my sodium intake to prevent toxicity. B. I should immediately report any new feelings of sadness or crying. C. I may experience a decrease in my desire for sexual activity. D. I can take this medication with St. John's wort for a better effect. C. Rationale: sexual dysfunction, decreased libido, is a common side effect of SSRIs and a frequent cause of non-adherence. Option D is dangerous due to serotonin syndrome risk. Question 2. The nurse identifies that a client taking sertraline Zoloft is also taking St. John's wort. The nurse should assess for which finding indicating a life-threatening complication. A. Orthostatic hypotension and dry mouth. B. Sedation and confusion. C. Agitation, muscle rigidity, and fever. D. Suicidal ideation during the second week of therapy. The correct answer is C. Agitation, muscle rigidity, and fever. Rationale: the combination of SSRIs and St. John's wort increases the risk of serotonin syndrome. The hallmark signs are agitation, rigidity, and fever, a medical emergency. Question 3. A nurse is reinforcing teaching for a client starting venlafaxine, an SNRI. The nurse should emphasize monitoring which parameter at home? A. Weight, due to risk of severe weight loss. B. Blood pressure, due to risk of hypertension. C. Blood glucose, due to risk of hypoglycemia. D. Deep tendon reflexes, due to risk of nerve damage. Answer B. Rationale: SNRIs elevate norepinephrine, which can increase blood pressure. Monitoring BP is a nursing priority. That's your essential study nurse IQ guide to SSRIs and SNRIs. Remember the 4-6-week delay, the side effects, and the deadly risk of serotonin syndrome. If this video was of value to you or added value, please head to our YouTube channel, Study Nurse IQ, and click subscribe. See you in the next video.